Okay, so this is for a blood draw. So start with everything, just doing my introduction, having drawing the patient privacy curtain, getting two ID indicators, um, hand washing, kind of informing the patient what I'm about to do, any questions that they have. With this, I need to confirm if they've had anything to eat or drink in the last 12 hours. And then, yeah, any questions that they have before I go ahead and get my equipment set up. Um, so, first, here's my arm here. I'm going to palpate the medium cubicle vein and then just check the location and then seeing if it's the tendency to roll. I will go ahead and grab, so that looks good. I'll go ahead and grab the alcohol wipe, open that up, and then I will wipe around that in a circular motion just to clean the area. And then I will just let air dry just to avoid contamination. Um, then I will go ahead and grab the patient's arm with my thumb here firmly, and I'll make sure it's approximately 2 inches below the puncture site. I will use my thumb to kind of taunt the skin and then I'll indicate to the patient before I go ahead and inject them there. And from what they said, it's between a 22 to an 18 gauge needle. So I will, after checking the vein and everything and cleaning, I'll put my gloves on. And then, like I said, the alcohol wipe, and then go ahead and grab the needle. So I'll go ahead and just kind of use my thumb about 2 inches below the injection site, kind of taunt the skin here, and then I'll indicate to the patient that they're just going to feel like a little pinch. I'll position the needle with the bevel side up, and then it'll be at a 30 degrees from the needle to the skin. A nice firm kind of pressure that will go in. And then once I do that, I will take the tourniquet off and then just have the patient untighten his fist. And that way the blood can flow normally. And then when I'm all done, I will pull back and have the patient hold that gauze on their arm while I fill up the tube. And then I will move the tube back and forth about 8 times just to make sure everything mixes in with the blood. And then I will label the tube and grab tape to put on the gauze, and then just inform the patient to hold it for a couple minutes just to make sure that it does dry and stops bleeding. I will clean up my area, throw everything in the way and the sharps that I need to, remove my gloves, hand hygiene, And then, like I said, make sure the tubing is labeled with the patient's full name, date, time, just to indicate for the lab, and the patient is all set.